customization treatment of Nori's eyes began way before the day of treatment. It begins in the exam room where we check to see if the patient's corneal reflex is normal, if the cornea is normalized, to see if the prescription is capable of being near or better than 20/20. All of these are signs that a patient is getting towards or the ability to have the best treatment possible. Having said that, even soft contact lenses can warp a patient's eyes and affect the customization treatment. So here what we do, even though it takes a lot more time, is we get fresh Wavefront customized readings of your fingerprint of your visual aberration on the day of surgery. From that, I design the patient's eyes, Nori's eyes in this case, and I find what is the best way for her to have the most optimal result. Every once in a while, believe it or not, and this is part of the surgeon-dependent part of the procedure, a more traditional, conventional way of measuring the patient's eyes is better than even a Wavefront. But for most patients, 90+%, it is best to use a Wavefront treatment because it can fix people's prescriptions to the 100th of a diopter, not just to the quarter of a diopter. So that might mean, say your prescription is minus 3.50, I can actually get it to minus 3.57. And that is very helpful in getting the best visual result possible. In Nori's case, she has a good amount of astigmatism. And how do I know that? We sent in the Wavefront system, that's Nori's pupil of her left eye, OS, we send light rays through there, bounce it from the back of the eye that will capture her specific visual aberrations, her fingerprint of blur, her unique fingerprint of blur, and from that we can find the prescriptions to the 100th of a diopter. When we look at it over here, this is actually an idea of what a patient sees that's blurry. She is more oval because she has a good amount of astigmatism, but her astigmatism is a normal astigmatism. If she was a perfect visual system, no human is a perfect visual system, it would be a dot. So this gives you an idea of what her blur would be. So from these numbers, from going to the Wavefront machine, I customize her unique treatment. From here, I bring it to the computer in the laser, where it's delivered to the 100th of a diopter. And that's why we believe we get such excellent results, and our patients tell us that they're happy with what we do for them.